Hi friends, this is Dr. Richard Ruhling here to share with you on Total Health Channel. Have some interesting information relative to a news release that I think is fallacious, and the title of the news release was How Coffee Can Boost Your Brain Health and how much you should drink. Well, I disagree with their article. I don't think you should drink any. I grew up in a home where my father had stomach trouble, and he was a physician, and he knew not to drink coffee. I never had a cup of coffee growing up, and or at any time in my life, because I chose not to go that direction with the caffeine. Has many different problems, and they're boasting of some of the benefits in this article this weekend, but not good. I'm going to take them one by one. You can see them in this screen right here. Hold on. Basically, hope you can see it. The first one on the body effect is it prevents Alzheimer's and Parkinson's. Well, I think that's fallacious. The point is that I think many times people die of other things, and so they don't get old enough to get Alzheimer's, and Alzheimer's is not reported in coffee drinkers. So they die from other things first. So it doesn't protect, I don't think. But anyway, number two is increases anxiety. And I wish I had a $10 bill for every patient I've seen that needed something for their nerves. They were anxious about this, or felt stressed, difficulty. We'll get to more later, but the idea is it creates a problem for a need for other drugs as well. Number three is that it boosts alertness and activity levels. Well, I would grant you that if you're traveling late at night, it might be good if you're feeling drowsy to take a cup of coffee and get to your destination safely rather than fall asleep driving. But in most cases, try to make your trips earlier in the day. So anyway, number four, protects the heart. This is certainly wrong. I had a year of cardiology fellowship at Good Samaritan Hospital, Phoenix, and I took internal medicine also in University of Arizona at Tucson, and coffee was not allowed in the Coronary Care Unit. In the context of a heart attack, it could trigger a fatal arrhythmia. It lowers the threshold for ventricular fibrillation, which is fatal in a matter of minutes. And it also triggers extra heartbeats, PVCs we call them, and that's why people think their heart skipped a beat, because it's premature. Increases the heartbeat more fast. Okay, that's not good either, because usually normal is considered between 60 and 100 heartbeats per minute, but the slower the heartbeat in general, athletes have a slower resting heart rate, because it has more time to rest between beats, and it has a bigger volume, more time to fill up the heart chamber before the contraction. So stronger heartbeat with more rest, lower resting heartbeat, as in athletes, is better than da 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 da. If your heart was going so fast like that, it's going to wear out and have trouble. It increases, it causes heartburn. Okay, this is not about the heart, it's about the stomach that feels like heartburn. But caffeine is a powerful gastric acid stimulant. It stimulates gastritis, causes peptic ulcers, and GERD, gastroesophageal reflux disease, because it weakens the tone of the lower esophageal sphincter or muscle. So you can get a belch and have acid coming up into your esophagus. Or it tastes very bad if you get it that far. So anyway, cut out the caffeine. Helps maintain muscle mass. Well, that's fallacious, I think, too, because it dehydrates you. You urinate more, and with less fluid, it seems that you have more body mass, but not true muscle. Okay, and increases the need to pass urine. Well, that's certainly true, but why do we need that at nighttime when we're trying to sleep? Wish we didn't do that, and so take a leave from coffee drinking. Improves mental health. Well, I think caffeine in most cases is an addiction, and when you get dropping levels of caffeine. You feel like you need coffee and you're stressed, and so when you take the cup of coffee, as somebody said, I'd kill for a cup of coffee. Well, that's not mental health. Yeah, you better quit the habit and get relieved of some of those tensions. Dampens sleep quality, and that is true. You can't sleep as well. People need sleeping pills. Additionally, this is another form of addiction that's signaled by coffee drinking. And by the way, Pavlov called coffee bad habit glue. It glues our bad habits together. If you need to quit smoking, and if you smoke, you should, quit them both at the same time. I had a mayor in a southwest city, Missouri, who said, Doc, I've tried many times to quit smoking, but this was the easiest I found it. Now, he didn't say it was easy, but easiest when previously he was drinking coffee, he couldn't quit. But when you stop the stimulant effect, you don't need the depressant effect of nicotine. Together they keep you in balance. Nicotine to tone your nerves down, caffeine to stimulate them up, bad habits, both of them, and quit those addictions by dropping them both at the same time. So let's see where we're at here. It worsens some headaches and improves others. Well, the reason it worsens the headaches is because you have a coffee withdrawal, and you can. But coffee can trigger certain types of headaches which you don't want, but it does not improve them at all. You get it on withdrawal in many cases, which is why drug companies put aspirin into with caffeine. It's anisine, but it helps cure the headache from withdrawal symptoms. And Excedrin is the same thing with Tylenol plus caffeine. If you're going through withdrawal, take a Tylenol, but don't take an Excedrin because it has caffeine in it. Don't take an anisine because it has caffeine in it. You won't get rid of your habit. Okay. Raises cholesterol. That's number 12. Well, how is it good for your heart if it raises cholesterol? Can't you see that they're tucking out of both sides of their mouth and reduces type 2 diabetes? I'm not sure of that either. I think that there are benefits to drinking hot water for digestion and weight control, which is number 14. If you drink a glass of hot water about 15-20 minutes before a meal, maybe squeeze a little lemon juice in it. Lemon adds a little interest and helps your digestion if you drink it before your meal. One of the worst things is to flood your stomach with cold water, ice water, during the meal. Just drink the water ahead of time and your digestion will be better. And it boosts gut diversity of the bacteria that are supposed to be good for us, etc. Well, that's, I would say, a minor benefit in comparison with all of these, and the last one is huge. I think they left it to last. Lowers risk of cancer. Not true. The New England Journal of Medicine, a lead article in 1981, can't remember whether, I think it was March 11 or 12 of 1981, on about 300 and some cases of cancer of the pancreas. Strong association with coffee, not with tobacco, not with alcohol, but coffee drinking can cause, I believe, cancer of the pancreas, and we've had it's one of the about the fourth leading cancer cause of death. So get rid of that. It's a bad habit, and I have a book